Vince Gray about this last fall, and he wanted to see how we could leverage the virtual technology to try to get more of a message out about what the health committee was doing, about how the council process worked, and make our process as transparent as possible for everybody who wanted to follow DC health issues. Just a big thank you to everybody who's written us about Councilmember Gray. He really appreciates that and is doing well. And just wanted to thank all of you for your well wishes that you gave him. And he was able to do his first hearing on Monday, and it went really well. It's a 7-hour endeavor. So he's excited to be back and excited to work with you all as we look at health issues in 2022. So what we'll do is we'll get right into it here and kind of talk about what we're hoping to accomplish with these webinars, and then go through the presentation and then take any questions that anybody has. And then you can always follow up later with additional questions by email if there's something else you wanted to ask later. So I'm going to try to share my screen here. And Malcolm, do you need to pass host back to me to share my screen? Or not? I think you do. Can you pass host back?
Let me see. Okay, do I go to more? Make the host. Gotcha.
Thank you. So Malcolm's going to give me host. Okay, great. So I'm going to put the put up our agenda for today. Can everybody see the agenda? Malcolm, can you see the agenda up there?
Yes, I can see it.
Okay, terrific. So we're going to go through a quick overview of what the Committee on Health does, our legislative scope, the membership, and then introduce us. Malcolm and I are on today. Michelle Loggins is also on our committee staff, and we'll introduce her to you next time. We're going to go through all the bills that have been introduced to the committee. So kind of give you a rundown of what's currently in the committee that's come down over the last 13 months, and give you a synopsis of where we think each bill is headed based on what Councilmember Gray has indicated his intentions are with the bills. We're then going to go through the performance hearings, what the council members' oversight focus is for the year, and then finish off with the schedule that we've got coming up for the Committee on Health. And we'll go through the whole schedule really for all of 2022. We've got it planned out. And finally, we'll end with just a brief discussion of some documents we've attached that you kind of might want to read on your own. I'm not going to go through those in detail here today, but we wanted to give them to you so you could have all the relevant information that's out there on these documents. So I'm going to shift over to another document here, which will be our PowerPoint and the main one that we'll go through for the day. So I'm going to shift to that right now, and I appreciate everybody's patience as we work out this process here. Malcolm, for some reason, I do not see my PowerPoint up. There it is, but why is it not showing up on the share? 1 second. Okay, screen share. Okay. PowerPoint. We're going to try this again, folks. Sorry for the delay on this. I have my PowerPoint up. It's just not allowing me to screen share it. So I'm going to close it and then reopen. If you can't show that, you have a problem. Okay. So reopening the PowerPoint, and now I'll try a screen share of that. And now it comes up. Okay, great. So now I have that as an option I can select. Malcolm, can you see the PowerPoint up on the screen right now? Okay, fantastic. So
yes,
as we said,
I can see it.
What we're trying to do with this is, Malcolm and I spoke with the council member, and he was really excited about the idea of trying to be more transparent and do a monthly virtual meeting. And we came up with the name Health Happenings for this. But if anybody's got better ideas, please send them to us, because that name is not permanent. We were hoping for something better. That was just the best thing we could come up with. So we're going to do this monthly. We're going to try to eventually shoot for the third Thursday of each month for it. We're going to do the third Friday of next month because there's something exciting on Thursday of that month. So circle your calendars for Thursday of next month. I just can't say what it is yet, but I want to pique your interest in it. And then I hope you circle that on your calendar and are ready to go the third Thursday of November to something very important for healthcare. So we'll talk first about what the Committee on Health's legislative scope is. The Committee on Health covers everything concerning health, environmental health, health occupations, and then the professional healthcare inspectors we have in the city. We don't cover matters that are related to environmental health within the Department of the Environment. That's under Councilmember Che's committee, but everything else related to health we cover. And that includes the following agencies. We have the Deputy Mayor for Health and Human Services, the Department of Healthcare Finance, the Department of Health, which more commonly known as DC Health, the Department of Behavioral Health, and then we have two independent agencies under our oversight purview, which is the DC Health Benefit Exchange Authority, and then the Not-for-Profit Hospital Corporation. The committee membership on the Committee on Health were chaired by Councilmember Vincent C. Gray from Ward 7. We have council members Mary Che from Ward 3, Brianne Nadeau from Ward 1, Charles Allen from Ward 6, and then Councilmember Christina Henderson at large. What most people don't know is that Chairman Phil Mendelson actually sits on every committee. Typically, the chairman will only come down and join committees if he's needed for a quorum, but he technically is a member of every committee on the council. So he could join us and make a surprise visit at any time, but usually, as I say, the chairman only comes down when is needed to make quorum. The Committee on Health staff, you see two of us here right now. I'm Eric Goulet, the committee director. Agencies I cover are DMHHS, the Department of Healthcare Finance, and then UMC. We also have Malcolm Cameron on board with us here. He's our legislative analyst for the committee. You have interacted with Malcolm if you've ever signed up for a hearing with us before. Malcolm covers Department of Behavioral Health and does so much more for us. He covers really any constituent issue that comes before us. You know, he connects to the right place and does a masterful job with that. So I'm sure Malcolm's usually the first person you interact with here at the committee and always is excited to get you connected to where you need to go. Not able to join us on today's call is Michelle Loggins, our Deputy Committee Director. Michelle is charged with dealing with the DC Department of Health and then all the associated health occupations boards and commissions that report up through that agency. So you'll work with Michelle on those issues. I sent around as an attachment a consolidated list of these bills that are introduced in the committee, just so you can print it out easier than having to go through the PowerPoint, but then I've duplicated that in the PowerPoint here so we can go through it easier. Currently, there's 18 bills that have been referred to the Committee on Health, and these are permanent bills that require a hearing and then would have to be put through 2 votes here at the council. I'm going to go through each of them rather quickly. I can then take questions on them afterwards, and I'll give you the following information about each bill. We'll give you kind of the name of it. We'll just really do a very brief summary of the bill, and then let you know Councilmember Gray's thoughts on where he wants to go with each piece of legislation. He's kind of indicated to us, during the hearings, what his thoughts are for the bill, and I'll be glad to relay that to you so you have an idea of whether this is something that may be coming soon to us, or if it's something that needs more work. So the first one that we have on the list is the Medical Necessity Restroom Access Act of 2021. The lead introducer on this was Councilmember Pinto, and the goal of it was to try to make bathrooms across the city, even if they were in a private business for employees, accessible to people who have medical conditions that require an urgent need to use a restroom. And this had a very good hearing. We're excited to mark it up. Markup is tentatively set for March 7th on it. And the goal here is to make sure that we never have somebody in a situation where they don't have access to a restroom if one is available. And I think we've got some protections in this. The one change Councilmember Gray wants to make on this, initially it was set to be the Department of Health. We've done some research on this. The Department of Human Rights is the agency that typically does these types of enforcements. So we're going to change it to the Office of Human Rights in the final bill that we do, and look for that bill to be marked up March 7th. The next one on the list is the Maternal Health Resources and Access Act of 2021. This was introduced by Councilmember Henderson as the lead introducer. It focused on doula expansion in the city as one of the main elements of it. This bill was incorporated into the fiscal year 2022 Budget Support Act. So no further actions required on it because it was already built into the budget legislation last year. And we're not going to be needing to mark that one up because it's already law. The next one here is the Minor Consent to Healthcare for HIV and AIDS Clarification Amendment Act. There's going to be another bill later on that also looks at youth issues. And I don't know if the Medical Society is on. We've made this ask of them, and we're going to work with them in this year to see if they're willing to do this. And they've already indicated that they would. What we want to do is have the Medical Society convene physician experts to kind of let us know what services youth should be able to get without consent of their parents. I think that's something really that we need to hear from physicians on first, to see if there are additional services the district should provide and allow youth to get without their parents' permission. Already we have certain services like vaccines that are on the regular schedule of vaccines. We have certain behavioral health services and certain women's health care or birth control services that are available to youth without having to go to their parent for permission. Now, any further expansion of that, I think we'd like to hear first from the medical community on that. So we're going to ask MSDC to lead a working group on that and then let us know from a physician's perspective what, if anything, more we should allow kids to be able to get without a parent's permission. Possible markup set for June 23rd, but we've got to see what the outcome of the working group is. This bill specifically dealt with HIV/AIDS treatment services. So there's another one later on we'll talk about as well. The next bill here is the Interagency Council on Behavioral Health Establishment Amendment Act of 2021. This was a bill that would set up an interagency council that would kind of lead cabinet level discussions regarding DBH. Councilmember Gray held the hearing on this. We hold a hearing on any bill that comes before the committee, but he felt that Dr. Bazran's concerns with the legislation were compelling, and he does not plan to do a markup on this legislation this council period. The next bill I won't spend time on because we withdrew it to add Councilmember Henderson as a co-introducer to the bill, but I'll go right to where we reintroduced it here, which is right here. The Substance Use Prevention and Treatment Omnibus Amendment Act of 2021. This was a bill that we worked on. Malcolm, you worked on this. Who was this with? Was this Pew Charitable Trust that worked on this with us?
Yeah, correct. Yeah,
okay.
Yes, Pew Charitable.
Yeah, so Malcolm's the lead on this bill. He worked with Pew Charitable Trust to introduce this legislation. What's complicated about it right now, and kind of making Malcolm and I take a look at it, is right now the Department of Healthcare Finance is engaging with the Medicaid to bring DBH services under the MCO contracts that are coming up, for the rebid this year. So we need to figure out how that impacts this bill, how the shift to managed care could change what we have in the bill for behavioral health services, and we've got to make sure we get that right. Malcolm and I are optimistically trying to get this one done for March 7th, because we'd like to get it done before the budget. Councilmember Gray had introduced the bill. I was excited about moving forward with it. So we've just got to see if we can get those issues worked out with this legislation, but potentially look for it on the March 7th legislative markup agenda before the committee. The next one here, the Department of Healthcare Finance Support Act. This involved the Medicaid contracts. It allowed for a waiver of CBE timeline goals to allow all 4 plans to be considered before the Contract Appeals Board. There's no further action required on this legislation because the council approved legislation that addressed this issue in October, and that then solves the immediate problem. And there's going to be then a rebid of these contracts coming up that I think will be before the council again in June. So no further action required on Bill 24-115. The Personal Medical Record Fee Amendment Act of 2021 is the next bill. This limits fees that healthcare providers can charge and third parties can charge for obtaining medical records. This bill has had a hearing already. There's still some issues we're trying to work out with it. There's definitely 2 sides to this bill, stakeholders on each side, and we're trying to see if we can reach a compromise on this for March 7th. We would like to try to mark the bill up at that time. The next bill is the Bedbug Control Act of 2021. We held a hearing on this bill last council period. The goal of this bill is really trying to address issues where you may have people with either mental health issues, sometimes seniors with dementia-related issues, who are living in a situation where their home has become overrun with bed bugs. And specifically looking at a place where the home adjoins other homes or an apartment adjoins other apartments, and the bed bugs can then spread to other residences. And we've seen even instances where they can pass through the walls of row homes into other row homes. So this would allow access to that individual's residence to try to address and remediate the bed bug issues. What we're really trying to emphasize with this bill is we're not looking to try to get anybody kicked out of their housing or make people who are already vulnerable feel like they're going to lose their home because of this. We really want to try to help people and address very serious infestation issues before they spread to other units and become worse. So we're trying to create a remediation fund for lower income persons who have serious bed bug issues, and then also connect them to behavioral health services if that's something that is needed, or adult protective services. Because oftentimes when you have infestations that are this severe that they would spread to other units, we see mental health or dementia-related issues along with that. So the bill is tentatively set for markup on March 7th. After we mark the bill up, it will then go to the committee of the whole on sequential markup because it will involve DCRA, who would be the implementing agency. The next bill we've got approved already is the Certified Midwife Credential Amendment Act of 2021. This is one of Councilmember Gray's bills. He was very excited to get this bill passed this year and then get this bill funded in the budget. So that's going to be moving forward with licensure of certified midwives by the Board of Nursing over the Department of Health. The next bill was introduced, lead introducer was Councilmember Che. It requires insurance policies to cover medically necessary foods if somebody has a specific disease or condition. There was really good testimony at the hearing about this. Councilmember Gray indicated he wanted to move forward with this bill for markup. There's just a few technical issues we do need to work out with this legislation, but we're excited to try to mark it up on March 7th and then get it ready for the budget. The next bill that we see here is the HIV/AIDS Data Privacy Protection Amendment Act of 2021. This bill was introduced by the chairman at the request of the mayor. It came from the Department of Health, and its goal is to prevent any identifying information being obtained through certain discovery or courts related to HIV status. We may put some other amendments that are technical in nature with this bill, and we'll go through those at the next one of the these webinars. Go through the amendments we would make to any of these bills that we're marking up. But the bill had positive testimony, and we're going to look forward to moving it on March 7th. The next bill we see here is the other one that I mentioned related to giving minors additional ability to access, in this case, medical records and then health appointments, making health appointments. What we want to be able to do is certainly allow our kids access to necessary medical services, but I think there's another side to this, which is parental consent. Where do you draw the line on that? Again, we will turn to our friends at MSDC, who did a great job advising us on the youth vaccine bill, to give us guidance from a physician's perspective about what, if anything, we should do to expand the ability of youth to get additional access to health services. The trick to these bills also is that with vaccines, there's no copay issue. So if you have a vaccine bill, you don't need to worry about where the bill goes necessarily. But if you start expanding to other medical appointments, there is a question then when you have potentially copays or just the cost of the service, who ends up paying for that? And that's something that the committee would need to address. That's step 2, though. Step 1 is hearing from the physicians about what, if anything, we should do from a health perspective on this legislation. The next bill we had a hearing on recently was the Beautician and Barber Behavioral Health Support Training Act of 2021. This legislation gives training for beauticians and barbers to help them, support and address behavioral health needs that present from their clients, who come, before them for, hair services. So this got some real positive testimony. I think there was some testimony also that said we need to make sure this isn't required for barbers or beauticians to get their license, and also make it clear that this isn't a substitute for mental health care professionals to do this work. We're incredibly excited about the bill. We heard some very positive comments about it. And what we're hoping to do is be able to get it marked up at the very next markup. I think what we do need to emphasize in this is it will require a little bit of money for the training, and then we would need to fund that in the budget. So that's why we're trying to get a number of these bills done on March 7th, because we want to, if there is a small cost associated with them, be able to include that in the fiscal year 2023 budget. Because as you know, if DC does not fund legislation, it becomes effective only subject to appropriations, and it needs to be included in the budget to actually activate here in the district. We can't pass any unfunded mandates as a legislature in the district. So we've got to try to get these bills marked up so then we can then fund them in the budget, and then that would put them into effect October 1st, which is the start of the next fiscal year. So the next bill we have is the up for hearing coming up on March 7th. Also, we're going to do the markup first and then have a hearing afterwards. This involves professional employer organizations, which are more commonly known as PEOs, looking at how they relate to the DC Health Exchange and what they would do in the city. And I see I have a typo here because I have the summary from the previous bill located in here. But what this would look at is how these professional employer organizations would register here in the city. And we'll have public testimony on this on March 7th. The next bill that we have up would look at the living facilities for social workers. This was introduced by Councilmember Tran White. We don't know much about this bill yet, but we're looking forward to hearing from the public and stakeholders on it on March 7th. And that one will be up, and we have two others on there. The next one is the Copay Accumulator Amendment Act, introduced by Councilmember Che. Councilmember Gray co-introduced this legislation. This would require health insurance to imply discounts, financial assistance payments, and vouchers to reduce out-of-pocket costs. We're very interested in hearing from the insurance community and from residents on how this bill could improve health here in the District of Columbia. So this one's going to be up also for hearing on March 7th. And then the last bill that's going to be on the hearing for March 7th is another one that was introduced by the chairman at the request of the mayor. This shifts the responsibility for criminal background checks for unlicensed persons who want to work in long-term care from the facilities to the mayor. We're really interested to hear from the facilities on whether this is a good change or not a good change, and then hear from the administration on why they feel that this legislation is needed. Now, with all of these bills, we'll see how the hearing goes before we consider markup, but we could mark up this legislation on June 23rd if Councilmember Gray feels that the hearing went well and that he feels the legislation is ready to go. So that covers all 18 bills that we currently have sitting in the Committee on Health. We've attached also to the document, which I won't go through right now, a full legislative blog that also includes proposed resolutions. We get a lot of resolutions that come before us for appointments to various boards and commissions. Those become deemed approved without needing the council to actively vote upon them. But we do look through the resumes of everybody who is appointed to boards and commissions just to make sure there's no irregularities there. And most times, everything checks out, and we just let those become deemed approved. So if you're looking for the full legislative log, we've attached that in the spreadsheet format to the email that Malcolm sent out yesterday. The next thing I'm going to go through is the list of the performance oversight hearings, and then talk about the issues that Councilmember Gray has indicated are top priorities for him. So the first hearing we've already held was January 24th, and we covered two agencies at this hearing, the DC Health Benefit Exchange Authority and the Department of Behavioral Health. So it was a really great hearing. We had 45 public witnesses show up to it, and Councilmember Gray had many questions for the agency, and then also some of the public who testified. The issues that he looked at this hearing is he asked a little bit about, with the DC Health Benefit Exchange Authority, about how the PEO registration would work. And then there was a lot of discussion there just about how we reach out to people in communities to try to make sure we've hit everybody and made them aware of the great services that we have through the DC Health Exchange. And DC has a 97% insurance rate, which is second in the country, only to Massachusetts, which has, I think, 98. But in reality, we really do have universal health insurance here in the city, because the only persons who aren't enrolled in health insurance are usually individuals experiencing homelessness or people transitioning in and out of the city. But anybody in the city right now has access to health services if they want to apply for it. So that's really exciting, and hopefully, the exchange will continue the great services they have right now. And they will ask me to say this, but they are in an open enrollment period right now. So if you know of anybody who's looking to change or enroll in health insurance, please reach out to the Health Exchange now before the open enrollment period ends. Also, with the Department of Behavioral Health, Councilmember Gray looked at his top priority, has been making sure we're getting naloxone wherever we can get it. He's introduced a couple bills last council period that expanded naloxone use to police officers and to hospitals, and then also to just various organizations. What we want to see is anybody, who may be at risk for a overdose, to be able to have this in their home. We're seeing a lot of overdoses right now in people's personal residences. Unfortunately, unlike a lot of places where it's just simply been a prescription drug overdose issue, opioid overdoses in DC are mostly due to fentanyl through illegal drug use. And we've been seeing a lot of the overdoses occurring in the population age, usually traditionally African-American men over age 50. And a lot of these overdoses occurring at home. And it's really sad. We're trying to get the word out to people through a variety of different means and how we avoid these overdoses. And naloxone is a key part of that strategy. Also, we looked at how there's DBH is spending federal opioid funds. We looked at the expansion of the school-based mental health program. We want to see this in all DCPS and public charter schools. The mayor and the council added money to the budget to be able to accomplish this for fiscal year 22. And we just got to make sure that those positions are filled, and that the really the kids who have experienced a lot of trauma due to COVID-19 being in the schools have full access to these services, because it's been a tough time for our kids, and we want them to be able to have a professional to reach out to if they need help coping with what they've been through. We also looked at expanding the Birth to 3 program. He really is concerned about making sure we've maxed out our opportunities in Healthy Futures for this year, and then wants to continue to grow the Healthy Futures program each of the next 3 years until we complete the proposal that Councilmember Gray put out in his Birth to 3 legislation. So we're going to continue to try to expand Healthy Futures each year for the next 3 years until we have achieved the goal of that program. And then finally, we looked at a review of the St. Elizabeth safety protocols. We want to make sure that the patients are treated in a safe manner. We want to also make sure the staff and patients have the appropriate COVID-19 safety protocols in place so that they're protected from COVID. And then finally, making sure that the security is in place where we don't have to worry about anyone leaving the facility that could be a danger to themselves or other people. So those are the issues that Councilmember Gray focused on at the Oversight hearing. And then Malcolm and I followed up after the hearing with additional written questions based on some of the public testimony and based on other questions that Councilmember Gray just didn't have time to ask. And we'll be glad to share those responses that we got from DBH with anybody who's interested in looking at them. So moving on, February 7th is going to be our next performance oversight hearing for the fiscal year 21 that ended on October 1st, and then the first 5 months of fiscal year 22 that we're in right now. We're going to have 3 agencies before the committee on February 7th, the Deputy Mayor for Health and Human Services, the Department of Healthcare Finance, and those agencies are both headed by Wayne Turnage, who serves in a dual role there. And then the Not-for-Profit Hospital Corporation, and then also the UMC Board of Directors will have before us. Now, UMC's Board of Directors is now a control board. that looks at fiscal management of the hospital. Councilmember Gray has made it clear it's a priority for him to keep UMC emergency department open and fully operational until the new hospital can open. So the issues that we intend to look at with this agency, with this hearing, for the Deputy Mayor for Health and Human Services, I'm sure you've heard Councilmember Gray talk about his goal to build a comprehensive healthcare system here in the District of Columbia. He's extremely excited about this. The Ward 8 Urgent Care Center is going to be opening any moment now in 2022. The Ward 7 Urgent Care Center is scheduled to open in 2023. And then finally in 2024, the new community hospital on the St. Elizabeth campus and the attached ambulatory care center are scheduled to open in late 2024. This is just such an exciting project. It was headed by the city administrator's office, and this fiscal year it shifted over to being headed within the Deputy Mayor for Health and Human Services. Wayne Turnage is obviously still involved with that. And then Ben Stutz is the project manager of this within the Deputy Mayor's office. We've attached an exciting PowerPoint, which I won't go into detail, but I really encourage everybody to look at. The Deputy Mayor for Health and Human Services shared their PowerPoint for the new hospital design, the services, and we've attached it to the materials that we provided today. The design is beautiful. The location is very convenient, accessible both by Metro Rail and Metro Bus, and then there's opportunities to park right behind the building. So if you get a moment, please take a look through the PowerPoint on the new hospital. I think you'll be very excited by what you see there, and let us know if there's anything you think we need to do differently with that new hospital, because it is our top priority here at the committee. Then next, the other thing we're doing within Deputy Mayor for Health and Human Services is making sure that the pilot program for encampments continues to proceed safely. There was some issues. We recently held a hearing in the fall on this. I mean, Councilmember Gray really wants to make sure that we're connecting people who are unhoused to permanent housing and making sure that they have the support services available to care for whatever needs they may have, whether that be substance use treatment, whether it be employment issues or mental health issues. We want to make sure people have access to services and that they are in housing and not out on the street. So that's going to be important to look at again when we look at performance oversight. With the Department of Healthcare Finance, we're going to continue to focus a lot on the procurement process for the new MCO contracts. These are the biggest contracts that occur in the city each year. The universal contracting process that the Deputy Mayor has designed is very exciting for Councilmember Gray, because what it does is it allows all residents in the city to be able to use their Medicaid health insurance at any hospital, any clinic, and any physician associated with the hospital. So it gives people for the first time in the city the ability to take Medicaid insurance and treat it like they would any other insurance and not be able to be restricted to certain hospitals. It's extremely exciting for the residents of Ward 7 and for Councilmember Gray. Additionally, we're going to look at the behavioral health integration into the MCO contract process. This is going to be complex. It's certainly going to be really important to do it right, and we're going to ask a lot of questions at the hearing on how that would work. The next thing that Councilmember Gray wants to focus on with oversight is making sure that we maintain and expand access to telehealth services here in the district. The council member, since he's returned to chair the health committee, has wanted to make telehealth a focus. I think we made a lot of light year improvements in telehealth services out of necessity when COVID hit, and we want to make sure that we're not going backwards on any of those, and that we're looking for further opportunities to expand access to healthcare services for our residents. We're going to look at the continued DC Healthcare Alliance reform implementation. We've been very excited that some of the changes that Councilmember Gray recommended through legislation have been in place throughout the pandemic, and that includes the ability of persons to not have to go in for a face-to-face interview to renew their health insurance, and the fact that we actually haven't disenrolled people for quite a while. I mean, Councilmember Gray has suggested that we move this to an annual recertification process, which would be very similar to what the Medicaid process is. We think that that's entirely possible because we've done it for the last 2+ years now. And the other thing that we want to make clear is that we don't think for recertifications, there needs to be a face-to-face requirement at a DHS service center. We feel that at any community-based clinic or doing that online is appropriate. And particularly with the pandemic right now, we don't want to discourage people from renewing their health insurance. Finally, we want to look at how to implement a Medicaid buy-in program, either this fiscal year or the next. Medicaid buy-in is something that was brought to us by residents with disabilities here in the city who emphasized that DC has not joined the majority of jurisdictions in allowing residents who are working right now with disabilities who are on Medicaid to be able to retain their Medicaid insurance if they get a raise. So right now they're stuck having to, in some cases, deny raises or promotions because they don't want to lose their Medicaid insurance. That's counterintuitive. We want our residents with disabilities to have every opportunity to accept promotions, to be able to go out and make a living. And this bill would allow them to contribute, as they made more money, to the cost of their care, which they said at the hearing that they were excited to do. So this is something that we're really going to push to get done in the next year's budget. And Councilmember Gray has indicated that he wants to see us either get that done through legislation or through the budget process. Finally, at the hearing, we're going to look at United Medical Center. There's a fiscal management board right now in place at United Medical Center. We're going to look at how that board has been operating throughout the calendar year. Councilmember Gray wanted to make sure that the board is preserving essential healthcare services at the hospital, keeping expenses under control, and then managing contracts better. We have had challenges with contracts coming to the council on a retroactive basis, and he wants to make sure that the control board is looking at how they would minimize having any contracts need to be ratified by the council after they've already gone into effect. That's something that we should be able to avoid at this point. And then finally, he wants to make sure that staff at UMC is connected to training and certification opportunities. Part of this will be on the hospital. Part of it will be on UHS as the new operator of the hospital. And then also part of it would be on the Department of Health through their health boards to make sure that if there's additional training or certification that would help these individuals either work at the new hospital or further their careers, that we want to make that available. And we're very excited to continue working with our union partners over at the hospital to see what we can do on this front. The final hearing for performance oversight is going to take place February 23rd. And this will be with the Department of Health, sometimes known as DC Health, here in the city. Issues that Councilmember Gray has indicated to me he wants to focus on for this hearing are COVID-19 protocols and vaccination strategies. These are obviously first and foremost on everybody's mind. With the public health emergency recently extended, we know we're going to be dealing with COVID a bit longer than we'd hoped in the city. But we want to hear from DC Health how we're looking statistic-wise, both in our hospitals and then just in the city with Omicron, and seeing what the path forward is, hopefully as we move to spring, warmer weather, and then moving out of the pandemic, how we move forward as a city. So we're excited to hear from Dr. Nesbitt on what her thoughts are on COVID and get an update on that. Also important is we want to look at how we're expanding birth to 3 programs within the Department of Health. The Healthy Steps program is a really important program that connects children to services at clinics, looks for issues that could avoid long-term health or mental health problems in the future. And then the lactation support program is something that Councilmember Gray has supported since he did the Birth to 3 Act, and want to make sure that those funds are getting out to organizations in the community that encourage lactation support here in the city. We want to continue to look at how we're expanding school nurses. Councilmember Gray has introduced legislation that has been approved by the council subject to appropriations, and we're looking to add money every year to it that expands the available pool of nurses. For the goal that he set is to have every DC public charter school and every traditional DCPS school have a full-time 40-hour-a-week school nurse. This is something that parents continue to talk to Councilmember Gray about, encourage him to keep fighting for this, and we will keep fighting for it in this next budget cycle to make sure we add money to get more nurses in schools. It certainly is a challenge right now with the national nursing shortage, but if we're not continuing to push on this, then we won't make progress. So that's going to be a priority at the hearing and then in budget season. 2 other issues we'll look at in oversight, look at how the Department of Health is implementing changes to its licensing program, and then also the reforms that they're making through their state health planning and development agency, known as SHPDA, as they take a lot of what was a paper process and convert it into a digital format, which should make it a lot more streamlined to go through the SHPDA process. We're always excited to look for ways to streamline that process, particularly in areas where we see health services that are underserved in the community. So those will be the focuses for oversight for the committee this year. If you have other ideas of things that we need to focus on, please email Malcolm and myself. Give us those ideas, include Michelle as well on that. And we'd love to hear from you on things that we may be missing or things that we should bump up to a top priority for oversight focus for these agencies. So please reach out to us with the hearings coming up. And if you are interested in testifying at the hearings, I'll tell you in a moment how you can do that. So the next thing I want to talk about, we talked a little bit about already, is March 7th will be our markup before the committee, 10 a.m. This is the tentative agenda. It's ambitious, but we're going to strive for it and hope we can meet it. We've got 7 bills that we're trying to mark up on March 7th. These are the bills that we've talked about already. And what we're going to do at the next one of these webinars is go through the changes Councilmember Gray is going to propose and markup on this legislation. So we'll walk you through any substantive changes that he's recommending from the introduced bills, and then give you his rationale for why he's considering those changes. And if all goes well and we get these bills marked up, we then, if there's a fiscal impact of them, can fund them in the fiscal year 23 budget. Also on this day, we talked a little bit about this during the legislative bills that we went through. We'll have 4 bills up for hearing that day. You can see the 4 bills listed here. And then also, just lost it there. And then also, if we get additional legislation referred to the Committee on Health by February 15th, we may also add that to the list of this hearing so that we can have a comprehensive look at all of the bills before the budget comes down. So that'll be March 7th. And if you are interested in submitting testimony, you can contact Malcolm here. Here's his information here. So reach out to Malcolm, and he always makes sure that we get all written testimony made part of the official record. If you're interested in testifying live at the hearing, you can also follow this process here. Now, we've sent you as an attachment all of the entire list of the council's performance oversight and budget oversight schedules. The budget oversight one is still in draft format, but it'll be updated, and we'll provide a updated copy at the next one of these webinars. So that way you can see the entire list of hearings, not just the Committee on Health hearings. At the back of that, you'll see this information repeated here. So it'll tell you how to get in touch with the Committee on Health and how to sign up to testify at the back of those 2 consolidated notices. And it will also show you how to testify before all of the other committees, because all of the other committee hearings are going on, and you can testify at any one of those hearings before the council. And similar formats, but there's slight differences in how you sign up to testify. So make sure you read at the back and read the differences on what each committee requires to sign up to testify. And then finally, you can always watch our hearings on either dccouncil.us, and then we stream them live on YouTube, because only one hearing can be streamed live by DC Cable, but we make sure that if we're not live on DC Cable, that we also do it through YouTube so people can watch it live that way. Just going through other important dates really quickly. February 3rd, 2022 is going to be the annual audit that we get. There'll be a briefing on that before the Committee of the Whole. This is for fiscal year 21, which is the fiscal year that started October 1st, 2020, and then ended September 30th, 2021. So there'll be a review of that fiscal year. It's always very important to look at that from an overall health perspective of the city's finances, but then also to check to see if the agencies within the health cluster spent the funds that were allocated to them in the budget. Sometime in February, we're trying to get a date to finish off the special committee on COVID-19 pandemic recovery. There'll be a markup of a report on that. That committee hasn't been given any legislative authority, but we do hope to get that markup done. We've been working with the Urban Institute on getting a report ready on that. And the co-chairs of this special committee are Councilmember Gray and Councilmember Charles Allen. And hopefully, if this can get done in February, that would be a good thing. Moving on to March 16th, this will be the date the mayor submits her proposed fiscal year 23 budget to the council. So that's going to be a very important date. We actually have our webinar set for the 17th. So I'm already planning for an all-nighter to look through the budget. Nothing's probably looking at me like I'm crazy right now, but planning for an all-nighter on the 16th to read the budget, and then we'll do a webinar on the 17th to give you our initial thoughts on what's in the budget. So that should be fun. You'll get first thoughts on the budget. And then March 18th is the committee of the whole public briefing before the council. This is the only time you see the mayor testify before the council each year. She comes in and presents her budget to the council formally at this briefing, and then stays for a round of questions, and then future rounds are done by the Office of the City Administrator. So that's always a very high profile hearing, and it's definitely interesting to check out. So then in the spring, what the Committee on Health will do is we move into what's called budget oversight. This is looking at the agencies under the committee's purview, how the mayor's budget did for these agencies, issues that the public may have with the budget, and then recommended changes they may make to these budgets. So on March 21st, we have the DC Health Exchange and the Department of Behavioral Health. On March 28th, we have these three agencies here, the UMC, the Deputy Mayor for Health and Human Services, and the Department of Healthcare Finance. And then we finish off our budget oversight hearings on April 4th with the Department of Health. So that will wrap up budget oversight. We will have one more hearing in July, which we usually do right before the council goes on recess, to hear testimony on any bills that have been referred to the committee after mid-February. That will allow us to then work on those bills over the summer, to have had public testimony on them and get them ready for markup in the fall. So moving forward to council budget schedule, we already talked about how the Committee on Health hearings will go, but this is the schedule then for approving the budget before the council. Mark your calendars for these dates. These are really important. April 20th and 21st are the date the council committees do the markups. This will be where you see a lot of the movement and changes being made from the mayor's budget to the council budget. It really at a granular level, this is where most of the changes are end up being made. Our markup is April 20th for the Committee on Health. The full list of the committee markups is available on the documents that Malcolm circulated that have the budget oversight hearing schedule. You'll see the markups at the end of that. There's going to be a budget work session, which is always broadcast live, where the council members get together and discuss the budget. That'll be April 27th. And then May 10th will be the first vote of the council on the budget. The council will vote on the Local Budget Act, which are all the local appropriations for first reading, and then also the first reading of what's called the Budget Support Act. The Budget Support Act includes any changes that are necessary to local law to effectuate the budget. So think of the Local Budget Act as being the numbers, and the Budget Support Act as being all of the supportive changes that you need to make to DC code to make those numbers make sense. So that's what will be voted on May 10th. May 24th, you'll have the council consideration up for second vote. DC is a unicameral legislature, so it is good that they vote twice on things. Every bill requires 2 votes. So you see the Local Budget Act will be up for second reading on this date. And then we'll have votes on 2 new things this day. So you'll see the Federal Portion Act. These are just the federal funds that are provided. There's always a vote on this. This goes up to Congress. These are usually things in the president's budget that are unique to DC. And this only requires 1 vote though, so that's why it's done just on this date. And then if there is a revised local budget submitted by the mayor for fiscal year 22, that would be typically done on an emergency basis and would be up for only requiring 1 vote. So that would occur then also on May 24th. So on May 24th, you'll have the second vote on the Local Budget Act, the first and only vote on the federal portion, and the revised local budget for the current fiscal year. Then in June will be sometime to be determined the second vote on the Budget Support Act for fiscal year 23. That it is not required to be approved within a certain amount of time, but it usually occurs then a week or 2 after the budget is voted on by the council. So that'll be up in June sometime. Next up, just kind of wrapping up what we're looking at for the year. June 23rd, these are all very tentative at this point. We've got to see how hearings and markups go, but these are bills that could be up for June 23rd markup, assuming that either the hearing or the working group that we're going to ask the Medical Society to do yields productive results. We could mark these bills up. Any bills that slip from the March 7th agenda will probably be moved to June 23rd as well. Then just to give you the full picture of everything before the Committee on Health, we're going to, in September, have another markup. These will be bills that we had a hearing on in July. And then October, we'll probably have a final legislative hearing. This is kind of the last chance hearing for legislation before the council period ends. And then the final markup before the Committee on Legislation will take place in October because what happens is if there's a bill before the committee and the council period ends, this will be the end of the 2-year cycle for council period 24. So any legislation that doesn't go through final reading will die in committee. So that's why you pick October for your final markup, because then you can do a first reading in November and then a second reading in December for that legislation. In December, the committee will do one last markup. We just do an activity report for the council period, and we typically then just have that report voted on sometime in early December. So we'll do that as kind of an end of the council period. And that gives you the full list of things that we have before the committee. Let me check to see if there's anything else that we need to cover. We have the attachments. I'm not going to bother bringing the attachments up. I'll just briefly explain why we attached what we did. We put the public health emergency extension legislation in that Councilmember Gray moved forward at the council. He worked closely with the mayor and Councilmember Pinto on this legislation. And the goal of the legislation was to be able to extend the public health emergency beyond what the mayor could do through her rulemaking powers. We've extended it to March 17th, and hopefully by that time we'll have warmer weather and our COVID numbers will continue to be on the decline. We also attached the 2 recent rulemakings that the mayor put out, one on extension of her authority of the public health emergency, and then the second on the extension of the mask mandate as well. So those are attached. I'm sure everybody's been following these issues, but we wanted to give you the actual documents there. And then finally, were there any other documents we included, Malcolm, that I'm forgetting about? I think that may be it. Oh, yes, one last thing. Yeah, we had the revenue estimate letter from the CFO. This was exciting news because with the revenue estimate letter, we saw that we got for fiscal year 22 an additional $357 million, and then an additional $346 million for fiscal year 23. So it's really good to see the district's revenue rebounding from COVID and rebounding on a recurring basis. So that's really good news. It means that the mayor could choose to use some of that money in fiscal year 22 if they do a revised budget, or they could carry it forward to use on a one-time basis for future fiscal years. So we'll have to wait to see what the mayor chooses to use that revenue for when her budget comes down before the council, but it's great to see the district's finances continuing to stay strong and then rebound to levels of revenue that we saw prior to COVID here in the city. So that kind of covers everything for our first webinar. Just as we said in the email, what I would ask you to do is to write us and tell us what you think was good about this, and then let us know, most importantly, things you think we should improve in the future, because we want to try to make this user-friendly for you. We sent you kind of a list of topics that we think we would do for future webinars. If there's anything we left off that list, please let Malcolm and I know, and we'll be glad to go over it. So I'd like to go through the questions here that are in the chat, and then if we want to open the floor up for anybody else, we can do that. So let's take a look here. Yes, I'm not going to, yes, I see a question from Regina here. Something special, not in November, it's in February. So for February, I may have misspoken and said November. So for February, circular calendars for February 17th and put a question mark there. It's going to be something exciting that's going to be announced soon. So I'm not going to tell you what that's about. I see from Robert Hay that they're happy to work with us on the physicians panel. Thank you, Robert, always for what you do with the committee. We really appreciated the leadership of the Medical Society and yourself on the vaccines for our youth bill that Councilmember Gray and Councilmember Che put forward. We really think that's going to open up opportunities for kids to be able to protect their own health if they need to, and get vaccines that are fully safe and recommended. Just to emphasize that it doesn't include the COVID vaccine yet for kids. It would just be traditional vaccines. So Robert, as always, thank you and the Medical Society for your work there. I see from the Health Alliance Network, they'd like to join MSDC working group. We can talk about that. I think we want to make sure these are physicians on there, but we're always excited to work with the Health Alliance Network. Ambrose, you and your team over there is great to work with. So if you do have physicians that are interested in participating on this, we would be glad to do so. I know you're doing a lot with the COVID vaccine, so we're excited to work with you, Ambrose, on that. I see here the next comment in the chat we have. Further the conversation on the SUD bill. We would be excited to do that. So I will definitely get in touch with you and email Malcolm and I to see what you'd like to do on the SUD bill, because we want to get that one done. It's really important to Councilmember Gray, and it's complex, and your assistance would be great on it. I'm not sure who M is. Who is M? You know who M is? Maybe not. That's okay. Well, whoever M is, email us and let us know, because we want to work with you on the SUD bill. This one here, does the bill requiring health insurers to cover medical?
I'm sorry, Eric. It was Mark Laboda.
Oh, Mark. Yeah, of course, Mark. Yeah, definitely we want to work with you, Mark, as we always do. And I appreciate you volunteering to do that. On the medically necessary foods, this would include private insurers too. So we're looking to do both Medicaid and private insurers. So if there's people in the private insurer community that want to reach out to us, we'll be glad to talk to you. We'll probably loop Councilmember Che's office into that. They were the lead drafter of the bill. We'd love to know what the private insurance community thinks with covering medically necessary foods. But we really feel that if there is a food that is going to help save costs in the long run for people, we want to make that available to them. Up next, we have in the chat. Let's see. Dementia training. Definitely, we want to keep working with you with this. We want to make sure that it's fully implemented, and yeah, okay, great. I see from the Alzheimer's Association, we need to continue to talk to DC Health about the implementation of the law we passed for training. I think this is really going to be really important to ask them about at the oversight hearing. So thank you for raising that with us. Please reach out. This is probably from Eric, I assume. I can't see it on my screen, but I'm assuming Eric sent us this. Eric, if you can reach out to Michelle and make sure that we include this in the questions that we ask DC Health, we definitely want to focus on that. It's a huge priority of the council members to make sure that that law is fully implemented. So please reach out to Michelle, and we'll be glad to do that. So here's a good question on the revenue projections, inclusive of ARPA funding. I don't believe so. That's a very, very good question. Typically, the funds that we see there for the revenue estimates are local funds only. So they don't include special purpose revenue funds. They don't include dedicated taxes. They don't include federal revenue. I think ARPA was all listed as federal money. However, there was an oddity where I think for last fiscal year, there was some funding that came in as like local ARPA funding. And I have to check back on it. Now, the good thing would be that funding should be spent already. So changes to the revenue estimates should only be from local revenue. Now, local revenue in the city are all our taxes and fees that are charged that go into the general fund to fund all the city's operations. So they don't include taxes or fees that are for specific purposes. So that would be exclusive local revenue, and great to see that it's going up again here in the city. So very good. Let's see what else we have. Okay. Happy to work with staff on the social worker bill from Veronica and the unlicensed background check bill. Thank you, Veronica. We're excited to work with you two on that, and we would be glad. Look forward to your testimony on that, and look forward to your thoughts on both of the bills. And then here's a good question from Ambrose. Will there be legislation mandating vaccines for school-age eligible children prior to school year 22-23? So, there already are the list of required vaccines for our kids at schools, which are on the traditional list of vaccines. Those would include the common ones that we know about, and those are the ones that are included in Councilmember Gray's legislation. I think what you're talking about here, probably, Ambrose, is the COVID vaccine bill. Would that be required? I know the council has taken up legislation on that. It's currently before the committee of the whole because it involves specifically vaccines for school-age children. I think we've got to look at exactly how they would do that, and I'll be glad to follow up on that because I don't know the answer off the top of my head about what the committee of the whole has done with that legislation. But we'll be glad to look at it and then get back to you on that because it's a very important topic to see, how our kids will be vaccinated and protected in the next school year. And we certainly encourage all children to get not just COVID vaccines, but get all vaccines on the schedule that they're eligible for, unless a medical condition prevents them from doing so. So that's great. And I think that completes the questions there. Ambrose, we will follow up on that legislation. We're glad to talk to you about that. I want to thank everybody for joining Malcolm and me today. This was the council member's brainchild. Malcolm and I talked with him about it, and he was very excited for us to be able to do this each month. So let us know how we can make it better. And thank you so much for taking time out of your day to join us. And if you're watching it on replay, please reach out by email and let us know how we can make the next one of these, which is going to be February 18th, even better. So it'll be February 18th at, is it 10 a.m.? We're back on the regular schedule, I think, at that time. So February 18th, 10 a.m. Come back, check us out, and email us in the meantime. And if you got this forward to you from somebody else, please email Malcolm and I your contact information so we can just add you to the regular list of people that we would sign up. So send that to both Malcolm and myself, and we'll make sure that you get these directly next time, and share the word. If you thought this was useful, the best thing you can do is please share it with other people because we want everybody to have access to this information. So thanks so much for joining us. Malcolm, is there anything else we need to do before we sign off here then?
No.
All right.
Good to go.
Thank you.
Appreciate everybody, and I'm available.
Have a great weekend and stay healthy.